All right, my name is Andrew Granello. Can you sit up, please? All right, my name is Andrew Granello. This is Jessica Kessler. Do I have consent to go ahead and do my neurological exam on you?
Yes.
Okay, perfect. Can you tell me your name?
Jessica Kessler,
So she's oriented to person. Can you tell me where you are?
Las Vegas. My
Perfect.
house.
You're oriented to place, and can you tell me who the president is?
Biden.
So we're oriented to time. All right, perfect. We're noticed that her speech was non-aphasic, perfect, in that it looks like she's definitely alert and not stuporous or turned over or anything like that. Okay. All right. So perfect. I'm gonna give you a situation. We're gonna test your judgment here. If your car was running out of gas, where would you take your car?
To a gas station.
Perfect. Judgment there is good. All right. What would you do if you were lost your job? How would you go about getting a new job?
I would apply for new jobs.
All right. Perfect. So your judgment is good. Okay. We're going to ask you just a quick memory test. I want you to remember these 5 words and then repeat them back to me. Okay.
Mm-hmm.
So pay attention. Person, woman, camera, TV. Can you repeat those back to me?
Person, woman, camera, TV.
Perfect. All right. So that's a good test of your short-term memory. Can you tell me where we first met?
At UCF.
Perfect. So your remote memory is also very good. Okay. Perfect. Do me a favor. Close your eyes for me. Stick your hands out. Can you tell me what's in their hand?
Coin.
Perfect. Go ahead and do me another favor. Can you tell me what's in your hand now?
A pen.
Perfect. That's a test for stereogenesis. Go ahead and open your eyes. And we're going to move on to the cranial nerve test. So first thing we're going to test is olfactory. So go ahead and give me that smell.
The lemon.
Perfect. She smells a lemon. Excellent. All right. Next thing we're going to do is we're going to test ocular motor nerve 2, abducens, which is cranial nerve 3, and abducens, which is cranial nerve 4. Yeah, and we're going to check trochlear, which is cranial nerve 5, okay? Or cranial nerve 6. So, abducens cranial nerve 6, trochlear cranial nerve 6, abducens cranial nerve 4, and ocular motor, which is cranial nerve 3. Okay, go ahead and follow my 6 cardinal gazes, down and to the left, perfect, down and to the right, perfect, up and to the left, perfect, up and to the right, perfect, up into the middle, perfect, up into the right again, perfect. So abducens checks for lateral eye movement, trochlear is downward and medial movement, and then ocular motor would do the rest. All right, perfect. We're going to go ahead and move on to the rest of just a regular eye exam. Can you take your glasses off for me? So using my right eye, I'm going to examine her right eye, following it all the way in. Perfect. Note the red reflex and that the optic disc is 3:1. Nice and orange back there. All right, perfect. We're going to do the same thing on the other side. Left eye to left eye. Perfect. Optic disc is 3:1. Follow the red reflex. All right, excellent. We're going to do the same thing again. I'm going to go ahead and look at your eye and make sure that there's consent. You have a good pupillary response and constrict. Perfect. We're going to do the same thing. Excellent. We're going to note that her right eye also was consensual and constricted. Same thing. Pupillaries constrict, and we're going to check the left eye for consensuality, which it does. Excellent. Perfect. We're going to check for accommodation now in nystagmus. Go ahead and follow my finger in. Excellent. Perfect. Definitely followed your finger in. All right. We're going to go ahead and check facial nerve, which is cranial nerve 4. Cranial nerve 7. Go ahead and shrink your forehead for me. Perfect. Go ahead now. We're going to check trigeminal. Go ahead and puff out your cheeks. Perfect. All right, excellent. We're going to check your cranial nerve 8 now. Oh, we're going to check also trigeminal nerve. I want you to tell me if this is sharp or dull. Okay? Tell me if this is sharp or dull.
Dull. Dull. Sharp. Sharp.
Perfect. Excellent. Okay. So we check that. We're going to check your vestibular cochlear cranial nerve, which is cranial nerve 8. I'm going to do the whisper test. So tell me. I'm going to tell me what you hear back to me. Okay.
55.
Baseball.
Baseball.
Perfect. She has a great whisper test. We're going to go ahead and move on to the Weber test. We'll go ahead and strike my tuning fork and put it on top of your head.
It sounds the same.
Perfect. Sounds the same in both ears. All right. So that's no type of any sensorial hearing loss. We're going to go ahead and do the same thing. I'm going to put this test behind your ear. Tell me when you can no longer hear it. Okay.
Okay. Okay.
Perfect. Same thing. We're going to do the. Tell me when you can no longer hear it. Okay.
Okay.
You still hear it?
Yes.
Tell me when you can no longer hear it.
No more.
All right, perfect. We're going to do the same thing because I missed that on the other side. But tell me when you can no longer hear it.
No more.
Perfect. Again.
No more.
Perfect. I'm going to go ahead and test your peripheral vision. Tell me when you can no longer see my finger.
No.
Perfect. So she could see pretty much all the way until I got to the back of her line of sight. Same thing here on the right. Tell me when I can no longer see my finger.
No.
Perfect. Okay. Excellent. So we checked that. We're going to go ahead and now check for visual acuity. Go ahead and tell me, can you read this line? Wait, cover your right eye. So with left eye, can you read this line?
EPTZO.
Perfect. Can you read this line underneath?
No.
Okay, cover your right eye. Read me that same line.
EPTZO.
Okay, take your eye off. Can you read that line again?
EPTZO.
So we're going to note that our left and right eye are both 20/30, even with corrective lenses, and that both eyes together are still 20/30, okay? Excellent. All right, so next thing we're going to do, move on. We covered all that. Okay, perfect. Go ahead and stick your tongue out for me. Notice that the hypoglossal tongue is in midline. Go ahead and press your tongue against your cheek. That's cranial nerve 12. Definitely has tongue strength. Definitely has tongue strength. Perfect. Stick your tongue out and say ah.
Ah.
So that's checking glossopharyngeal. You can go ahead and close your mouth. Glossopharyngeal and vagus. Go ahead and swallow. Same thing. We're testing glossopharyngeal and vagus. Definitely has good swallow. And we would do a gag reflex, but I'm not going to gag my fiance here. That seems a little excessive. So we're going to skip that. We're going to go ahead and check your spinal muscle now. Cranial nerve 11. Go ahead and shrug your shoulders against my hands. Perfect. Go ahead and push your. We're going to check more sternocleidomastoid muscle. Go ahead and push your hand against me. Perfect. Go ahead and push against me. Perfect. Excellent. All right. Very good. Okay. Now we're going to do tactile sensations. So I want you to tell me if you can feel this. Is it sharp or dull?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Perfect. All right. Excellent. So she got all that. Okay. Next thing we're going to do is check your strength. So I already did this, but shrug your shoulders. All right. Perfect. I want you to take your arms and pull like you're pulling against me. Perfect. Same thing. Now push me down. Perfect. Excellent. Go ahead and grip my fingers. Excellent grip strength. Okay. Go ahead and push my hand away. Perfect. Now pull me in. Perfect. Same thing on this side. Push me away. Perfect. Oh, excellent strength noted bilaterally. There's no weakness or anything going on there. Excellent upper extremity strength. Okay, we're going to check your reflexes now. We're going to check the trapezius. So I'm going to hit right above your elbow. Okay, 1, 2, 3. Perfect. We're going to check your bicep reflex now. 1, 2, 3. Perfect. And we're going to check your brachioradialis reflex. Okay, 1, 2, 3. Perfect. We're going to check the other side. Trapezius reflex. 1, 2, 3. Perfect. Bicep reflex. 1, 2, 3. Perfect. And brachioradialis reflex. Perfect. All right. So we checked all our deep tendon reflexes. We did strength testing, tactile sensation on all your upper extremity. That's very good. Okay. Let's see your. Go ahead and lay down for me. Now we're going to do tactile sensation on the bottom here. Go ahead and tell me if you feel dull or soft.
Dull, sharp, dull, sharp, dull, sharp, dull, sharp.
Perfect. Okay, so we did that. I'm going to go ahead and test your patellar reflex. 1, 2, 3. Perfect. We're going to check your Achilles reflex. Well, we'll do the Achilles one last. We'll do your other patellar reflex. 1, 2, 3. Perfect. We're going to check Babinski. Can you just put your feet up a little bit higher? Perfect. We're going to check Babinski. Strike the bottom of the foot. Perfect. Toes fanning and flexing. That's what we want to see. 1, 2, 3. Perfect. Okay, excellent. All right, go ahead and sit up. And then we're going to do the Achilles one now. Have your legs hang there at the end. We're going to go behind here and strike here. 1, 2, 3. Boom. 1, 2, 3. Boom. We're going to check right above the Achilles tendon there. We're going to hit that reflex, okay? All right, now we're going to check strength of your hips. So go ahead and lay down like you did before. All right, we're going to lift this leg up. And I want you to push your leg up against my arm to the outward. Perfect. Inward. Perfect. Same thing on this leg. Outward. Inward. Then outward. Perfect. Go ahead and push down now with your leg all the way. Check your quads. Perfect. Same thing. Upward. Perfect. Same thing on this side. Down. Up. Check your feet. Go ahead and push down. Perfect. Push up. Perfect. All right. Can you move your left feet inward? Excellent. Outward. Perfect. Excellent strength everywhere. Go ahead and sit up for me. This is a test I'm going to do. I want you to tell me if I'm moving your joint up or down. Okay? So close your eyes. Stick out your hands. Am I moving your finger up or down?
Up, down, up, down.
All right. Same thing with your toe. Am I moving it up or down?
Down,
Up or down?
up, down, up.
All right. Perfect. Excellent. So we did that test. All right. Now we're going to have you walking. So I want you to do me a favor. This is what's called a tandem walk. I want you to walk in this imaginary straight line for me. Just like this, like I just did. Can you do that for me? Like we're walking a straight line for the cops. All right, we're going to note that that first step was a little off balance, but now much better. Okay, perfect. We're going to test for Romberg now. I want you to stick your arms out. All right, I'm going to stand right behind you. And I'm going to push your arms down, and I want to see if you know how your balance is. Ready? 1, 2, 3. 1, 2, 3. Perfect. Okay, excellent. Go ahead now, and you didn't fall over. Your balance is good. Coordination is good. Now we're going to walk heel to toe in front of me. Okay? 1, 2, 3, 4, 5. Flip. 1, 2, 3, 4, 5, 6. Perfect. All right. that concludes the neurological exam. Thank you very much.